Hi everyone, welcome back to our channel ADC MythBusters. I hope everybody is doing well and good. And I know it's been a while since we've uploaded much videos, but because of the new year and everything, it's been a bit of a ride. Now today we are back with another video talking about the revised communication rubrics, which was very recently released by the ADC website. And we will also be overviewing a couple of tips and tricks which you need to keep in mind when you're going through these communication tasks for your practical examination, especially on the OSCE day. Without much further delay, let's get started. Now, the rubrics, as we had talked about in our previous videos, are basically the pointers which are related to your OSCE communication tasks, wherein you need to keep in mind a couple of things when you're talking to your examiner or when you're presenting your cases. Whatever the day you are dealing with, whether it's your OSCE day or your technical day, these rubrics are extremely important because this gives us an insight regarding what the marking or the grading pattern could be for your examination. Like I had mentioned in our previous videos regarding the different clusters which need to be assessed when you are going through your examination, the technical day clusters are there as well as the clinical skills day clusters. Now for your technical day, there are two clusters, the restoration based tasks and the preparation based tasks. More details about these can be found in our previous videos. I will definitely provide a link for those videos in our description box below. Apart from that, the clinical skills day, also called the OSCE day, are also having different kind of clusters. And the first cluster is the clinical information gathering. The next one is diagnosis and management, after which comes the clinical treatment and evaluation cluster, and last but not the least is your effective communication. Apart from that, infection control overall is a very important cluster to be kept in mind when you're going through your practical examination of ADC. For you to pass in the examination, you need to have a pass in all the clusters, which means each of the cluster might have 2, 3 or 4 tasks, but your main goal is to make sure that you have an overall pass on each of the clusters to have an overall pass in your examination. You need to pass on your technical day as well as your OSCE day separately. Another thing to keep in mind is if your infection control by any chance is not a pass, your overall examination will also not be a pass. Our next video will possibly be about infection control, so do stay tuned. Now we will talk about the certain revised communication rubrics that was very recently released by ADC. We already knew from our previous video and the discussions we had that there are 5 types of grading which is given by ADC. Of course, we don't get to know what we have been graded in the examination. It's just pass or fail. However, it does help in understanding the entire grading system so that we can prepare much better and we know how to exactly analyze our own tasks. The first grading criteria that has been mentioned by the ADC regarding the communication tasks is very good. To get a very good grade, you need to show a very good amount of comprehensive and appropriate interpersonal skills, emotional skills, as well as sensitivity towards the patient's concern with the right amount of cultural sensitivity as well as, appropriate amount of empathy. Empathy becomes a very important part of your effective communication. If you do show them the right amount of empathy, which you would otherwise show your patients when you're seeing them in your own clinic or your own practice, needs to be also portrayed on your examination day. Satisfactory grading comes when the above pointers which I just talked about is kept in mind, but not so much. So you're probably being attentive towards a couple of things that the patient tells you, but not all of it. Okay, that's when you're coming in the satisfactory range. Borderline, on the other hand, is when you're not showing the right amount of the, above pointers like interpersonal skills or emotional intelligence. you're being very, rote about it, you're being very monotonous about it, and you're not being able to establish a good rapport with your patient, herein the examiner. These things are very important as a part of your rapport building, which becomes a very crucial part of your effective communication cluster as well. So if you do make sure that you're, being a good listener, you're being a very good doctor to your own patient, these issues with your effective communication and going into the borderline or the unsatisfactory category also comes down. Unsatisfactory comes in when the above pointers are completely absent, when you have been not too diligent regarding the patient's concerns, you have not kept in mind the small things. Like, for example, I will give an example here wherein your patient might be telling that he recently had a divorce. It is your duty to not just be a good listener and not just move away from the main concern of the patient, which might be, let's say, a tooth pain or maybe some kind of pulpal pathology. You need to keep in mind that the patient is also going through some kind of emotional distress, which might be adding to his stress. So be empathetic towards it, but don't deviate from your own topic. Or let's say your patient has recently gotten a good job or maybe a promotion. Again, congratulate your patient before going forward, so that you do show the patient that you are concerned, you are listening, you are attentive. These small things make a lot of difference when it comes to your effective communication skills. Now, there are certain other criteria which need to be kept in mind so that you again can establish a good rapport. Many of these are related to your body language as well. The first thing to be kept in mind is basically how you're establishing good eye contact with your patient. Whether you are folding your hand, whether you are, moving your hands too much, how you are sitting, how you are, keeping your hands on the table, these things make a difference. Have constant eye contact. It makes sure that the patient is, being listened to, and they feel that the dentist is being attentive towards them. Apart from that comes your speech. So there should be appropriate clarity of speech. You should be empathetic, like I've been saying repeatedly, and not sound that you're too aggressive or you're too loud. Be clear in whatever you're talking. You might not have the most fluent English, but that does not make a lot of difference. If you're able to communicate properly, put forward your points properly, your English skills or English speaking skills can also be kept behind. Be quite relaxed when you're approaching the examiner or each of the rooms when you're entering, so that you go with a clear mind and you go with an open mind that however your examiner is going to be towards you, you are going to be quite open and you are going to be a good dentist, and the person who's sitting in front of you is nobody but your patient, and you are going to give them the best treatment plan. All right. Be professional, be friendly at the same time. Make sure you do not cross your limits when it comes to interpersonal skills. So that is again an important point. Show the right amount of respect, be patient, be empathetic, and you will be good to go when it comes to effective communication. Just these small things, if you can incorporate in each of your 10-minute communication OSCE presentation, you will understand how much you are getting better with your OSCE skills. Apart from that, there are certain other things when it comes to language usage, which is important. When you are presenting your OSCEs, make sure that each of your presentation has open-ended questions. Don't ask them what kind of pain they're getting. Is it because of cold or hot? Instead, keep the question open-ended. Ask them what causes them the pain. Is it something specific? Let them answer it. Keep it quite open-ended. Apart from that, use the correct language which is appropriate to the patient's knowledge according to the patient's literacy. This in our OSCE language we also call as jargons. Try to avoid any kind of jargons or any medical or dental terms which might be difficult for the patient to understand. For example, a rubber dam can be explained to be sort of like a raincoat. These small things will also make a difference. Show them that you are listening to them. Very, very important. Even when it comes to actual clinical practice, being a good listener and being patient, towards your concern, towards the concerns that your, patient is telling you is also very important. Discuss things with them, tell them what can be good for them, what can be bad for them, listen to them, encourage them to ask you more number of questions. These small language skills also will make a lot of difference in your OSCE presentation. Apart from that, it is also important in certain cases to understand what your patient exactly wants. For you, a particular type of treatment may be good, however, the patient may not be in agreement with you. Try to understand what they're actually wanting, or where they're exactly coming from. Ask them that what is their goal, why they're asking for a particular treatment or rejecting a particular idea. All right. Value their feelings, value their cultural background, value where they're coming from and why they're asking these questions. That's where patience also comes in. Understand that what could be the patient's barrier towards getting certain kind of treatments, whether it is cost, whether it's their culture, whether it's any other interpersonal relationships the patient is going through. These things need to be kept in mind while we are going through the treatment planning. Apart from all of these things, certain times we need to talk to the patient in such a way where the treatment planning is not just based out of our own ideas. The patient also gives us, approval. Without getting consent, we cannot go forward with any kind of treatment. Consent lies to be one of the most crucial part of treatment planning. And consent comes where the patient understands not just the pros, the cons, the long-term goals, the short-term goals, the costs, everything. When the consent comes, only then we can go forward with whatever treatment we have planned for the patient. Exactly how we work in a dental clinic. So what are the things which are coming under joint decision making? First and foremost, it's proper understanding. Everything should be understood properly by the patient. Share information in a much brief but in a very concise manner. Frame the information according to the patient's original concern. So if the patient's concern is something regarding aesthetic, tell them more about aesthetics before function. Yes, function is something important, but so is aesthetics. Discuss all these things on different kind of options for the patient. Don't give them just one option. Give them multiple treatment options. And having no treatment at all is also one of the most crucial options. Give them the correct amount of motivation, whether it's for oral hygiene, smoking cessation, stress control, whatever it is. It is important to make sure that the patient gets overall health benefit out of his or her visit to the dentist. Constantly keep checking with the patient. Is he or she able to understand what you're saying, or you're just talking to a blank wall? This again becomes a very crucial part of your effective communication. Clarify things, brief out things, summarize certain things when you're explaining certain, procedures or pathology or, pathophysiology to the patient, so that you know that your patient too is at par with you. Encourage them to ask you certain questions, participate you and understand these things which you're telling, whether these are certain pros, certain cons, whatever it is. Ask them what makes them comfortable, what they are ready to go for. At the end of your presentation, make sure you have a proper closure. Certain times it can happen that you may run out of time, and as a result of which you're not able to finish that particular communication OSCE. But make sure you summarize whenever possible, get certain kind of closure, get the consent when required. This will make sure that not only are you wrapping up your entire case presentation, but also that the patient is able to understand what you have said, and patient hearing your examiner is also quite clear regarding where you're coming from. This will show that you are not only being patient-centric, you're also being very sensitive towards their thoughts, their consent, and these things do make a lot of difference. Give them review appointment, tell them short-term and long-term goals, and all of these things become a very important aspect of effective communication. You may think that these are just minor rubrics to be kept in mind in certain cases, but these are important overall. As I have written here, effective communication is the key to patient management and acing the OSCE communication tasks for the ADC examination. You may be saying the right amount of information, the correct information rather, but if your effective communication, your language skills, your interpersonal skills are not at par, you may not make it in the task. So make sure these things are definitely kept in mind.